Ultrasonic instruments have been widely used as a valuable adjunct to conventional hand instrumentation for many years. The selection of either ultrasonic or hand instrumentation should be determined by the clinician's preference and experience and the needs of each patient. The success of either treatment methods is determined by the time devoted to the procedure and the thoroughness of root debridement. In practice, clinicians typically use a combination of both ultrasonic and hand instrumentation to achieve thorough debridement. Ultrasonic instrumentation is accomplished with a light touch and light pressure, keeping the tip parallel to the tooth surface and constantly in motion. Leaving the tip in one place for too long or using the point of the tip against the tooth can produce roughening of the root surface and overheating of the tooth. The working end of the ultrasonic instrument must come in contact with the calculus deposits to fracture it and remove it. The working tip must contact all aspects of the root surface to remove plaque and toxins thoroughly. Although as much as 10 millimeters or more of the length of the ultrasonic tip vibrates, only a small portion of it can be adapted to contact the curved root surface at any one time or point. As with hand instruments, a series of focused, overlapping strokes must be activated to ensure complete root coverage. Importance: subgingival root surface roughness does not seem to interfere with healing after scaling and replanning. Thus, it does not appear useful to re-instrument root surface with hand instruments after clinically detectable smooth surface has been created with sonic or ultrasonic scaler. Contraindications to use the ultrasonic and sonic scaling devices: older cardiac pacemakers, known communicable diseases that can be transmitted by aerosols, patients at risk for respiratory disease, including patients who are immunosuppressed or have chronic pulmonary disorders, patients with titanium implants, porcelain, and bonded restorations, unless you use plastic tipped inserts. In magnetostrictive ultrasonic units, the pattern of vibration of the tip is linear, and in piezoelectric ultrasonic units, the pattern of vibration of the tip is elliptical. Both are false. Two types of ultrasonic units are magnetostrictive and piezoelectric. In both types, alternating electrical current generates oscillations in materials in the handpiece that cause a scalar tip to vibrate. Depending on the manufacturer, these ultrasonic vibrations at the tip of the instrument of both types range from 2,000 to 45,000 cycles per second. In magnetostrictive units, the pattern of vibration of the tip is elliptical, which means that all sides of the tip are activated and will work when adapted to the tooth. In piezoelectric units, the pattern of vibration of the tip is linear or back and forth, meaning that the two sides of the tip are the most active. Sonic units consist of a handpiece that attaches to a compressed air line and uses a variety of specially designed tips. Vibrations at the sonic tip range from 2,000 to 6,500, which provides less power for calculus removal than ultrasonic units. Ultrasonic and sonic tips are designed to operate in a wet field with a water spray directed at the end of the tip. Within the water droplets of this spray mist are tiny vacuum bubbles that quickly collapse, releasing energy in a process called cavitation. Cavitation water sprays serves to flush calculus, plaque, and debris dislodged by the vibrating tip from the pocket. Magnetostrictive ultrasonic tips generate heat and require this water for cooling. Sonic and piezoelectric units do not generate heat, but still utilize water for cooling frictional heat and flushing away debris. The dental endoscope is a device that consists of a reusable fiber optic endoscope over which is fitted a disposable sterile sheath. It fits onto periodontal probes and ultrasonic instruments that have been designed to accept it. This device allows clear visualization deeply into the subgingival pockets and furcations. It permits the operator to detect the presence and location of subgingival deposits. Now, the enhanced visual assessment system is a system that uses motor-driven diamond files to correct overhanging or over-contoured proximal alloy or resin restorations. EVA system. That's the EVA system. It's enhanced visual assessment, which uses a motor-driven diamond file to correct overhanging over contoured proximal alloy or resin restorations. A Profi Jet air powder polishing device was the first specially designed handpiece to deliver an air-powered slurry of warm water and sodium bicarbonate for polishing. It is very effective for removal of extrinsic stains and soft deposits. Polishing powders contain aluminum trihydroxide or other substances rather than sodium bicarbonate are being used to offset the abrasive effect of sodium bicarbonate on restorations as well as dentin and cementum. Contraindications to the use of air-powered polishing devices are those patients with respiratory illnesses, hemodialysis, hypertension, and infectious diseases. If a patient experiences sensitivity, that's another question. If a patient experiences sensitivity while being scaled, an ultrasonic scaling device